Well, good afternoon, everyone. Late yesterday, we got the news that we had been waiting for in regard to our young people 12 years of age and up, that they now can be vaccinated. I got a text this morning and a picture from my granddaughter, Mary, that she got her vaccine. I know that from reports we're getting that people all over Ohio, young people are starting to get vaccinated today. Here we have 14-year-old Evelyn Exline, and who got her shot today at OSU Wexner Medical Center East. And this certainly is another step as we move forward. We're joined this afternoon by Dr. Dane Snyder, Section Chief of Primary Care Pediatrics at Nationwide Children's Hospital, where a vaccine clinic for Ohio children is underway, adolescents. Doctor, good to see you. How are things going? I think he's muted.
Things are going very well, Governor. Thank you.
No, that's great. What advice do you have to parents who might be watching this and are thinking, you know, maybe I got the vaccine, but maybe some hesitancy about my child? You know, we're always more careful about our children than we are about ourselves. And what advice do you give to parents who are kind of looking at trying to see what the science is on this vaccine for their 12, 13, 14, or 15-year-old?
Yeah, those are really good questions, and questions that we answer all the time from families. And there are several reasons that we, give to families if they have questions or hesitancy about whether or not they should get this vaccine for their kids. First and foremost, we know from research that 12 to 15-year-olds, in addition to older teenagers and adults, are protected at extremely high rates when they get the vaccine. And not only does it protect them, but it helps protect spread in the community. One of the other myths that we hear about all the time is that kids cannot get COVID-19 or they never get sick from it. And we know that's not true. While they have less frequent severe symptoms from it, some children will develop very severe symptoms. Everyone's probably heard of MIS-C, which happens in children. And the third reason, which a lot of people might not think about right away, is more related to what you can do. So once you're fully vaccinated and you have a possible exposure in the community, it's very likely you won't have to quarantine, you won't have to miss school, and you won't have to miss sports and extracurricular activities.
And that's a big deal. I mean, that really is a very, very big deal. I know you have with you Mrs. Carla Crawford and her son, Caden. I wonder if we could talk with them for a moment.
Of course.
Good afternoon, Governor.
Mrs. Crawford, thank you very much. Caden, good to see you.
Good to see you too.
Caden, you got the shot today, did you?
Yep.
How did things go?
Great. Nothing, no pain, no nothing.
So did either one of you have any hesitancy about this at all, or what was kind of your thought process?
We really didn't have any hesitancy. We really want to be able to protect not only Caden and ourselves and our family members, but we also want to do our part to help protect our community.
And kind of from a personal point of view, what are you looking forward to as a family, once everybody gets vaccinated?
I think what we're looking forward to is Caden is excited to be able to go back to school full time. He's excited to be able to continue to participate in his soccer with the Crew Academy. They have travel that's coming up, and this will help protect both he and his teammates from being more safe from COVID-19.
Well, that's great. Any other, Caden, you have any other siblings?
No, sir, I do not.
So it's you guys, and so now you got everybody
Yes, sir.
vaccinated and moving forward.
We do. All of us are vaccinated now.
Well, thanks for sharing with us. We appreciate it very, very much, and our best to both of you. Thank you.
Thank you.
Thank you.
Thank you very much. Good luck, Caden. So for those parents and children who are interested, there are hundreds of locations where those 12, 13, 14, and 15 can today, right today, be vaccinated in the state of Ohio. They include pediatricians' offices, primary care physicians, vaccine clinics, local health departments, hospitals, community health centers, and many, many more. We will be airing a new PSA starting this weekend about rolling up our sleeves and getting vaccinated that features Cleveland Browns coach Kevin Stefanski. Let's take a look at that ad.
Ohio knows how to get things done. We're not afraid to take on the tough jobs. To beat COVID and get back to the things we missed out on last year, we all need to roll up our sleeves. To get back to the theater, back to dining out, back to fairs and festivals, and back in the stands on Sundays. It's time to roll up your sleeves, Ohio. It's time to get to work.
Learn more at gettheshot.coronavirus.ohio.gov.
Coach, thank you very much. We appreciate the message. Eric, let's go to the slides, data for today. And we'll start off, we've got cases down a little bit from where they've been the last several days, so we're always happy to see that. Let's take a look at the next one, Eric. Again, all 88 counties ranked by highest occurrence. We like the fact that the white is moving over, which is good. That means those counties cases are certainly getting lower. Let's take a look at the next one, Eric. Magic number today, 119.9. Of interest yesterday, it was at 123. So this is a significant drop, 3.1. And this has varied somewhere between 1, 2, and 3 as far as the drop. The drop has been pretty consistent for some time now. And we're happy to see the 3, and we're moving forward. Eric, let's take a look at the next one. Our cases, this is the number of vaccinations that are done. Yesterday, over 26,000 first doses, and that represents 42% of the population. As you can see, we're getting close to the 5 million mark. Let's look at this second vaccine or fully completed doses. Again, those numbers are good. Yesterday, 32,000 people got their final dose. That represents 36% of the population and almost 4.3 million of us. Next one, Eric. Hospitalizations, always a lagging indicator, but certainly something we keep track of. We have a drop, a significant drop. Now these kind of go up and down, but we're seeing a steady drop in hospitalizations, now well under 1,000. And that certainly is a good thing as well. Last night, I announced the Ohio Department of Health Director, Stephanie McLeod, will be ending health orders effective on June 2nd, 2021. I got a call a few minutes ago. Wanted to know, is that morning, night, when is it? And basically when you get up on that day, the health orders are off. Ohioans have done a fantastic job protecting each other, protecting your families, protecting yourself. Our cases have dropped, as we have said. We've seen this drop for some time, not where we want to be yet, but we put a mark up there at 50. And I don't know when we're going to hit the 50, but going down 3 points today and 119.9 cases per 100,000 today is certainly good news. The hospital drop is good as well. Fewer Ohioans are in the hospital since we've been vaccinating. We've been seeing at least a 75% drop in COVID-19 hospitalization count since we got the vaccine. So good. Today, 935. On January 10th, just to put it in perspective, we were at 4,200. Last night, I also announced that starting on May 26, 13 days from now, we will announce a winner of a drawing for adults who have received at least their first dose of the vaccine. Excited about that. Got a lot of calls today about it. This announcement will actually take place on every Wednesday night, 7:29. The lottery has a slot of 1 minute, and you will see that announcement made on there, and it will be every Wednesday night, starting 13 days from now. The pool of names for the Ohio Vax-A-Million drawing will be derived from the Ohio Secretary of State's publicly available voter registration database. We'll also be making available a web page for people to sign up for the drawings if they're not in a database that we're using. The Ohio Department of Health will be sponsoring the sponsoring agency for the drawings. Ohio Lottery will conduct them, and the money will come from existing federal coronavirus relief funds. To be eligible for this drawing, these drawings, you must be 18 years of age or older on the day of the drawing. You must be an Ohio resident, and you must be vaccinated before the drawing. We also have a drawing, as we announced yesterday, for young people. 12 to 17-year-olds are now being vaccinated. We have that separate drawing that will also be on Wednesday, the 26th. Again, we'll do 5 of those, 5 Wednesdays in a row. We'll announce the winner of a drawing of all those 17 and under who've been vaccinated. The winner will receive a full scholarship to any one of Ohio's great state universities. That includes room, board, tuition, books, the whole shot. Next Tuesday, another key date, May 18th, an electronic portal will be open for young people who've been vaccinated to be able to register. Again, we'll do this every Wednesday, 5 straight Wednesdays, and again, it will be within the lottery's 1 minute slot at 7:29 p.m. Early in the pandemic, Congress put in place the Federal Pandemic Unemployment Assistance Program to help Americans get through this very, very difficult time. Among other things, this program gave states funding to offer enhanced unemployment benefits. At first, it was originally $600 on top of the normal unemployment benefit. Later on, the federal government changed that to $300. When the program was originally put in place, it was a lifeline for so many Americans at a time when really the only weapon we had were defensive weapons. Keep your distance, masking, sanitation. Things now, of course, have changed. We're in a very, very different phase of this today. We have a tool that is unbelievably effective, and that, of course, is the vaccine. As I noted last night, and I've said many, many times, we have a powerful and effective vaccine that now close to 5 million Ohioans have already received. If anyone has not gotten the vaccine, there are appointments and walk-in clinics available today. All throughout the state of Ohio, we have 1,900 places where you can go today. You can also go to gettheshot.coronavirus.ohio.gov. That's gettheshot.coronavirus.ohio.gov right now and find a location near you. Ohio's economy, I'm happy to say, is clearly in recovery. Our unemployment rate is 4.7%, significantly lower than the national average. As I travel the state, employers tell me all the time that their businesses are coming back. And they also tell me that they're having a very serious time finding employees. Many employees who are with these companies are having to work very, very long hours. I've had employees tell us they don't want to work those long hours, but that's necessary in that particular job because of lack of additional employees to be hired. You can see the signs looking for workers and oftentimes even offering a sign-on bonus. You can see those signs around the state. This isn't just about restaurants or retail establishments. I'm hearing similar concerns in manufacturing and in the commercial industries. It's having a real impact on Ohio's ability to fully recover and to come back. We're coming back, but we need to come back as strong as humanly possible. And it's having an impact and it's slowing that recovery down. The federal assistance, that extra $300 a week in federal pandemic unemployment compensation is, in some cases, certainly discouraging people from going back at this point in time. The assistance was always intended to be temporary. So today I'm announcing that our administration will be informing the United States Department of Labor that we intend to stop participation in this program on June 26. June 26. This will give people time to hear about it, to understand it, and also for people who have a fear about going back to work and they have not yet been vaccinated, that's going to give them the opportunity to become vaccinated. They're going to be able to get the Pfizer and Moderna and then get the second shot, or they're going to be able to get the Johnson & Johnson, the one shot. Plenty of opportunities around the state, but we want to give people the opportunity to be able to get that vaccination if they've not already done so. There's good news that our Ohio Means Jobs website is currently listing more than 181,000 openings, and more than half of those pay $50,000 a year or more. For those Ohioans who are looking for work or who may be looking for a new opportunity, our administration has been aggressive in addressing the skills gap since the day we took office. These programs have continued to be highly popular during the pandemic, and I'd like now to turn to the Lieutenant Governor, John Husted, to tell us more about that. John?
Well, thanks, Governor. I'm going to just start out by, I guess, probably being a little redundant with some of the things that you said. There's no doubt that the bonus payment made sense at the beginning of the pandemic as people felt vulnerable for the virus, and there weren't enough jobs for all of the unemployed to go out and find. But now that everybody's been vaccinated, can be vaccinated, and everyone who wants to can be fully protected, we're at a different phase. The Ohio economy, I have to emphasize, is rapidly recovering. The unemployment rate is back to where it was, approximately where it was at pre-pandemic levels. We're 4.7% nationally, or 4.7% in Ohio, 6% nationally, and that's in March. And we know that there have been a lot of jobs that have been created since then that we can't fill. Just to give some, on the ground perspective, I was traveling the state the last 2 weeks promoting the abundance of in-demand jobs that are being created throughout Ohio and the education and training programs that can prepare you for these jobs. The jobs and job training are out there. Just to put this in perspective, the NFIB reports a record high number of small businesses who say they have job openings that they can't fill. I tell you, I've been involved in economic development my whole life, and I have never experienced a time where employers have expressed more desperation about the need for a workforce than now. And I'm not talking about an opening here or there. I've talked to employers who have dozens to hundreds of job openings they can't fill. I was on a call just an hour ago with some heavy equipment manufacturers, just with 4 of them, who at their respective companies said one could say they could hire 23, the other 15, the other 12, the other 100 employees at their Ohio operations today. And these are good paying jobs. Bloomberg News just came out with a report that shows U.S. job openings reach a record high of 8.12 million in March. And I know Ohio's share of that is probably disproportionately high. As companies around the globe began to expand and make new investments coming out of the pandemic, the ability to provide a workforce is emerging as the primary factor in their decisions. And states that can favorably respond when we get that call about an expansion, when we can demonstrate that we can supply the workforce, we win those jobs. And those jobs are not just here now. Those would be the jobs that people will have long into the future for years to come. Just today, I talked with an employer who discussed this potential policy change of the $300 bonus, and he said that would help him justify expanding manufacturing in Ohio versus another state that they're considering. These are very real decisions that employers are making. You cannot create a job until you have somebody who's willing to take a job. And as you alluded to, Governor, I think this is important. That's the business side of things. But as I've been out there, I've been talking to a lot of employees. If you remember way back in the early days of the pandemic, we talked about all of these essential businesses, people who were out there with their employees working every day to provide us the goods and services that we all needed. And there are a lot of people out there who've been working nonstop throughout this pandemic who tell me they are overworked and they are exhausted. I have heard from these employees whose employers can't find enough people to hire. And so the employees who are on the job are working 55 plus hours a week, many of them tell me, since the pandemic started. And while they love the overtime pay, they are exhausted. They said it's putting a strain on them and their families, and they need to go back to a normal work schedule. And so to do all this, we have an abundance of resources for these potential employees, resources to help them return to work. We've talked a lot about these at our news conferences throughout the pandemic. OhioMeansJobs.com is probably the richest resource, statewide resource, but you also have the local Ohio Means Jobs job centers. These are people that can not only help you get access to the training that you need to help you find that job that's right for you, maybe connect you with the transportation you need to get it. Also, all of those other resources that you might need to help with your children, childcare, other family issues they can eliminate those barriers to you actively finding meaningful employment. And those are available at our local Ohio Means Jobs centers. Training programs, as we've been talking about, TechCred, the IMAP program that's a partner of TechCred. All of these are resources where you can get free training that literally between if you enrolled now, many of these training programs can be completed before June 26th. Many of them take weeks, some of them a month or less, that prepare you for these $50,000 a year jobs and more, which there are many of them available at Ohio Means Jobs or the other work search resources that are available through Ohio Means Jobs. And we want to help you. We've got resources there for you to rejoin the workforce. And we know that if we can do this, we help more employees get back to work, which means they're building a work history, which typically will qualify them for healthcare benefits, vacation, 401k benefits, and other job training resources that can help them climb that mountain to meaningful, fulfilling careers. Right now is the best time to start because there's so many jobs available, and let us help you get connected to those jobs so that you can improve your quality of life and as we emerge in this growing, expanding economy. And with that, Governor, it brings me to an announcement from the folks at Recovery Ohio. This is in conjunction with the Ohio Department of Job and Family Services, Recovery Ohio, the Governor's Office of Workforce Transformation, and working partners. They have come together to create 3 new recovery-friendly training modules. These training programs will help employers develop their own approach to hiring and retraining or retaining employees who are in recovery. We know that this is a critical part of recovery for many individuals and having a sense of purpose and belonging within their workplace environments. These online video modules are intended to empower employers to reduce possible apprehension at the thought of hiring or retaining an employee who's in recovery. So we want to help both the person that's in recovery and the employer who's trying to hire or keep them. These 8 modules can be found at recoveryohio.gov, in addition to 5 other previously launched modules that were done in conjunction with the Ohio Chamber of Commerce in 2017. These are science-based training modules that encourage and empower businesses to hire and better manage employees who are in active recovery. And then finally, Governor, if I could, I would like to just mention something about National Police Week. We want to thank all the officers who are out there who are sacrificed for all the citizens of Ohio. They're real people like us. They're moms and dads, spouses, brothers and sisters. But I met with a group of officers yesterday during this week. I wanted to hear directly from them what it was like right now to be a member of law enforcement. They expressed to me that they are increasingly feeling unsupported, with some leaders advocating to defund police and actively pursuing those policies, also eliminating qualified immunity protections for members of law enforcement. They explained to me that they are seeing a number of their colleagues retire early, and enrollment in their police academies and training programs are down. So they asked me if I would say something about this, and so I did. I know we all appreciate what they do. So during National Police Week, I just think it's important that we acknowledge how important the men and women in blue are to protecting our property and our loved ones, so we can have a safe, livable, and prosperous communities to live in across Ohio. And I ask that during National Police Week that you reach out to one of your local police officers, talk to them, get to know them, and let them know how much you appreciate the work that they do. So Governor, really appreciate the announcement that you made on a lot of fronts. I know that there are people out there who will benefit economically for your leadership on these issues. And we're going to support folks every way we can to give them the resources they need to rejoin the workforce and help grow the Ohio economy even faster than it's already growing. Thank you, Governor.
Well, Lieutenant Governor, thank you for your comments. Thank you for your comments about police. From the time that I became a young assistant county prosecuting attorney in Greene County and started really working with police officers, sometimes riding with them, I've had great admiration for our sheriffs and our police officers, sheriff's deputies. So we're grateful for the work that they do every single day. We're ready for questions.
Governor, first question today is from Sarah Arthurs at the Findlay Courier.
Thank you, Governor. I'm wondering if you can speak to what led to your decision to remove the health orders prior to getting to that threshold of 50, and if there are any concerns about people such as young children who can't be vaccinated.
Sure. I mean, we always have concern about children who cannot be vaccinated. We're looking forward to, we hope, by August or early September, to be able to, vaccinate down as low as 2 years, whatever the experts tell us. So we're certainly looking forward to that. We are moving towards that 50 number. Whether we're going to get there or how that's going to coincide with the date, that I selected to take the health orders off, I don't know. We'll see, but we're certainly, it appears we're really headed in that direction, and it may be close to that period of time, but we'll have to see that. I made a decision, after talking to a lot of medical experts and thinking about it, that the time was now. We now have within the grasp of every Ohioan the ability to protect themselves, the only exception of those who can't get it yet. But we have the ability to do that. And that's why, I want to really focus on vaccinations. These are lifesavers. This is how we get out of this. This is how we move forward. Each individual now has the facts. They know how to protect themselves. And I think people, will use common sense and will make those individual decisions. Federal government just came out, I guess, a few minutes ago with, more guidance in regard to wearing masks. But I think, again, people have seen the power of these masks, and there are going to be places where they certainly want to wear them. And if you certainly are not vaccinated, it's a very different ball game than if you are, in fact, vaccinated. And people now have that information. They can make their own decisions in regard to that.
Next question is from Marty Schlaten at the Ohio Capitol Journal.
Good afternoon, Governor.
Hey, Marty.
What specific data do you have that shows that people are not returning to work due to these unemployment supplements, as opposed to some other dislocation, economic dislocation that was caused by the coronavirus pandemic?
Yeah, Marty, I think it could be many, many things. You know, we hear this all the time. But, you know, if you look at why jobs are not being filled, I'm sure it's a multiple reasons. But whenever you go in and, you know, the market is distorted in that sense, you have certain consequences. And you can do that and should do that, you know, when you're in the crisis. And we're coming out of the crisis from economically. We still have COVID, but we have the way to deal with it today. So this couldn't go on forever. The federal government was going to end this, at least unless they change their mind, they're going to end this in September. We're moving it up a little bit. We think that's the appropriate thing.
Governor, I can add to that. You know, there's several elements to this. First of all, we're just going back to the traditional system. We had a 4% unemployment rate when we came in. We now have a 4.7% unemployment rate. All of the data shows that there are ample number of jobs out there available. Individuals who had hesitancy before now can get the vaccine. As the governor and I both said, it made sense to help people have the extra resources when there weren't enough jobs and when they couldn't get the vaccine. Now there are enough jobs and people can get the vaccine. But if you looked at the data yesterday, the consumer price index data, it went up, inflation went up 4.2%, because in many cases, as you talk to employers and employees for that matter, they are not able to keep pace with productivity because they don't have enough people to come to work. There are literally, you ask for data, I've actually talked to individuals who've said to me, it doesn't make sense for me to go back to work because I make more on unemployment than I do working. And I don't blame them. I mean, I don't cast any blame on the individual because the government made a policy that said we'll pay you more not to work than to go back to work. And we just have to correct that policy when things have stabilized. And now I believe it's time that we do that. Things have stabilized. But if you don't have people going back to work, if the child care center can't open because it can't find employees, then moms and dads can't go back to work at the construction company or the manufacturing company. And if the construction company and the manufacturing company can't keep pace, that slows job growth and opportunities for others. And so we're all connected in this wonderful economy. Thankfully, under the governor's steady hand, during this pandemic, he's protected lives and livelihoods. And we have a recovering economy where employers are now creating jobs faster than we can provide the workforce to fill them. And so, and the other thing is, he's giving them plenty of time until June the 26th. As I mentioned, there are lots of training programs that we can help people get to and get the resources and get them connected to vaccines and jobs in advance of that. And literally, we're going to be able to create jobs. We're going to be able to attract jobs to the state that other states are not going to be able to do, which will have a long-term benefit that will accrue to the workforce of Ohio. I think that there's plenty of evidence out there that supports it was time to make the move in this direction.
Next question is from Alex Ebert at Bloomberg.
Thank you, Governor, for holding this. Can you talk a little bit about how you decided to create the $1 million incentive for getting the vaccine and where you think you can derive authority from the controlling board's appropriation to do so? I think it highlights sort of the incredible latitude that the office has to use money from the federal government in regards to coronavirus response. So if you could talk about how you find the legal authority to do so and why you think this is a good use of the money, that would be helpful. Thank you.
Sure. As far as the legal authority, the money was sent to the states for the specific purpose of helping us battle COVID. There's no more effective tool. The most effective tool today is the vaccines. We have 42% of Ohioans who have been vaccinated, over 52%, I believe, of those who are 18 years of age and older, of the adults. So we have a ways to go. And I believe that we have people out there who have not yet made up their mind and people who have just kind of put it off and it just wasn't a top priority. So being able to get more people vaccinated has a tremendous benefit for every citizen in the state of Ohio. It has a tremendous benefit, particularly if people get the vaccine now as opposed to later. We're effectively pulling them out of the group of people that can get it and the group of people that can in fact spread it. Before the announcement, I talked directly to the speaker. I talked to the Senate president, told them what I intended to do. They did not raise any issue in regard to controlling board at all. This is money that's already passed through the controlling board, my understanding, and it's in our health department. We have spent a lot of money fighting this virus. And there's a lot of different ways to do it. And we have always felt that the money that we were spending was thoughtful. We've always felt that it was worth it because we know the huge human cost of this virus. And we also know the huge economic cost as well. We announced, I played a video, a PSA that's going to start running. We have been running PSAs. Other states are doing them as well. Other states are doing many, many, many things. So I think about this every day. And I think about what more can we do to slow the virus, get us back totally to normal, save lives, protect people. The answer always now comes back, vaccination, vaccination. That is the key. And when Fran and I have traveled around the state, we've been in, 40 probably different vaccination sites, and we always make it a point to talk to those who are being vaccinated. And what has struck us is that there are some people who, why are they there that day? In some cases, it's because we've now opened it up so they don't have to have an appointment. They just got up that morning and heard it on the radio or read it, and they said, hey, I'm going to go get vaccinated. Some people want to be able to do that. Other people are there because their son brought them. We had that case in Cincinnati last week, and I talked to an individual and said, my son brought me. Son said, hey, it's time. So we got people who have got their vaccine. We've got people who have not gotten their vaccine and absolutely say, I'm never going to get it. That's fine. We respect that. It's the people in the middle who are going to determine, whether we get the numbers that we need to really tamp this virus down. That's where the game is. That's where the action is. And so being able to create an added incentive that may appeal to some of those individuals seemed well worth the money to do it.
Next question is from Jeff Reddick at WSYX in Columbus.
Jeff.
Governor, to be clear, do you believe that, by spending $5 million plus, that the state has exhausted all other ways to get the vaccine to people or to convince people to be vaccinated, that there are no other options? I'm sure you've seen that this has been called a grave misuse of taxpayer dollars, a game show gimmick, unethical. It's a lot of criticism. Was there no other way at this point to convince people?
Look, Jeff, I've listened to that description of a lot of things I've done for the last year. I understand. I did not go into this and make this decision thinking that everyone was going to say it was a wonderful idea. But I have an obligation, and that is to do everything I can to save lives, everything I can to keep Ohio moving forward. And this is one tool we had not used. Are there other tools out there? If I can think of them, or if you can think of them, or anybody else can think of them, we're open. We're open to do whatever we need to do because we know how powerful the vaccines are. And we know that this is about human life, and it's also about moving Ohio forward economically. And I know there are people say, well, that's a terrible waste of money. Crazy DeWine, terrible, terrible waste of money. What's a waste is at this point, when we now have the vaccine, and when someone dies of COVID because they didn't get the shot, that is what is the human waste. And so I'm going to do what I can. I don't say that we've exhausted every idea. There may be other good ideas out there, but we're going to do whatever it takes to keep Ohioans safe, keep Ohio moving forward. And I think this is something that will influence people, and some people who maybe are going to get the shot eventually, but they're not sure when. Maybe this gets them to get it this week. And we know that someone getting the vaccine today versus them getting it in 2 months or 3 months helps all of us because it slows down that virus.
Next question is from Andy Chow at Ohio Public Radio and Television.
Hi,
Andy.
Governor. Back to the unemployment assistance. When we're talking about the people who have not gone back to work yet, if there are people who aren't going back to work because of an extra $300 and that's discouraging them from finding a job, what do you think that says about the wages that are offered to workers in Ohio right now?
Look, Andy, we operate on a market economy. That's how businesses are able to survive. And you always get into this question. I got it when I was in Congress. You can take wages up. You could pass a minimum wage at a very high level. The question you always run into, and the trade-off, the economists will tell you, the trade-off always is, do fewer people have jobs? And so I am very optimistic about Ohio's future. I think our economy is rolling, ready to roll even faster, though. I think we've emerged from this pandemic in pretty good shape, but we have a lot of growth area, and that growth can benefit workers. That growth can benefit the economy as a whole and help all of us. So I think it was time. This was always, idea was temporary. And I think we're at the point now, no worker should fear going back because of COVID, because they now can get a shot and they could get the second shot. Or if it's one shot, Johnson & Johnson, and they've got time. If they haven't done it yet, they've got time to do it. So, you pretty much remove that problem. There also are many jobs out there. Now, that doesn't mean that everybody can get a job, but what our obligation is, what my obligation is, what the Lieutenant Governor's obligation is to make available to everyone who is not employed ability to upscale their talents and to provide that opportunity for them. And we've worked very hard on that, and we're going to continue to work hard on that as well.
Governor, if I could add to that, Andy, look, the amount of money that you need to have to live varies from region to region. The amount of money that a job pays in rural Ohio, where I grew up, and what it takes to live there compared to what it takes to live in Columbus or Cleveland, a little bit different. But I can tell you this, I have been traveling the state the last 2 weeks. You can look at the publicly available data on Ohio Means Jobs, 90,000 plus jobs available just on that website alone that pay $50,000 a year or more, not to mention the number of jobs that are out there that pay $15 an hour or more. The employers that I am talking to in the state, they're not paying minimum wage. Minimum wage jobs almost, they're in that we long since passed that number. Employers are paying a much higher wage right now and still unable to find the people that they need. And I want to emphasize, this administration's been really focused on making sure that we make it easy for people, adults, students, to get access to training free of charge. thanks to the generosity of the taxpayers of the state of Ohio. On these news conferences, since day one of this pandemic, essentially, I have been trying to tout the pathways for people to get trained, knowing that this day was going to come where the pandemic would be over and there would be a rush to fill the jobs that were being created. And, everything from auto technician to machinist, CNC setup, marketing analytics and implementation managers, manufacturing technicians, CDL drivers, STNA certifications. These take days, weeks, and months to complete and lead to many jobs that are $50,000 a year or more. The training is available. Contact your local career center. Contact your local community college. Go to your Ohio Means Jobs local service center. The training and resources are available. Today is May the 13th. Most of these courses can be completed before June the 13th to help you be ready when that day comes for some of the many great jobs that are out there. So we are committed to helping people. We are creating the opportunities, and we have pathways for them to get to work to some great paying jobs in this state.
Next question is from Jackie Borchert at the Cincinnati Enquirer.
Hi, Governor. I'm going to return to Alex's question that went unanswered. Who is responsible for coming up with the lottery idea, and how was that developed?
I'm sorry, I couldn't understand you, Jackie. You were breaking up. I don't know. You said who's responsible for what?
For coming up with the lottery idea, and how was that developed? Were health experts involved? Where did the idea come from?
Came from me. Buck stops with me. My responsibility, my decision. Somebody on our staff came up with the idea of how to provide a scholarship for students, or came up with the idea to provide the scholarship for students because you couldn't participate in the other one. So, we talked to, as far as how to carry it out, we certainly talked to people in the lottery. We talked to certainly some health people. Look, no one knows what it takes for sure to motivate people. I think I've read everything that is out there. But I do know anecdotally from just talking to people who are getting their shots that there are some people who aren't against it. They're not for it. They're just, they pushed it back a little bit. Maybe they'll get it. Maybe they won't get it. And that's the way life is. You got people who are adamant they want to get it. They already got it, most of them. You got people who are adamant they don't want to get it. They won't get it. But it's the persuadable people in the middle. And what is it going to take? And it's probably a combination of things. And if this can be one more thing that we can put on the scale that makes it attractive, and we can save some lives, and we can slow this virus down quicker, certainly the right thing to do. Let me put it in perspective. We have spent millions and millions and millions of dollars trying to fight this virus directly. And the economic toll on Ohio, the human toll on families, you cannot calculate. So $5 million plus the money it's going to take for 5 scholarships, complete scholarships, it's a significant amount of money, but it is a very small part of the money that's already been spent in Ohio to fight the virus. And it's a fraction of the economic impact that this virus has had and still has on the state of Ohio. So buck stops with me, my idea, and we're going to see if it works.
Next question is from Mike Livingston at Gongwer News Service.
Yeah, hi, Governor. You said that you've gotten a lot of calls on the lottery idea. I guess I'm wondering who you're hearing from, what they're telling you, and our lawmakers. You said repeatedly they have your cell number through this whole pandemic. Are you hearing from them as well? Thanks.
Yeah, I don't know if I've heard from any lawmakers. I'd have to check. but I didn't talk to any lawmakers. Look, I'm hearing what's, what people are saying on TV, what people are saying on radio. I've had people contact me directly. The way life usually is, people that like what you're doing, they contact you, you hear them. I've gotten some contacts from people who say, it's not fair. It's not fair. Why should, I got my vaccine, and why should, we be spending $5 million to get other people to take it? My answer is pretty simple. When somebody else gets the vaccine in the state of Ohio, it benefits all of us. Matters a lot.
Next question is from Molly Martinez at Spectrum News.
Hi, Governor. I want to ask you about lead. Abating lead in Ohio has always been a priority of yours since you were sworn in. And in our biennium budget right now, $10 million are going to programs like SHIP, which help with lead abatement in low-income homes. But last May, they had to stop taking applications because so many families applied for that program and their resources were completely exhausted. There's a new proposal to add an additional $10 million for lead abatement. What are your thoughts on that?
I'm for spending more money on lead abatement. It's very, very important. We've got a proposal that we will be announcing shortly in regard to this. You have, as you know, Molly, you have two separate problems. You have lead in houses, old stock houses that poison kids, paint. Then you also have the lead problem in that the water lines coming into their houses sometimes are lead. So we've got to work on both of those. It's very, very important. Teachers have told me the cognitive development challenges that some kids face because they've been exposed to lead, and they've been poisoned by the lead. And it's not right in 2021 to still have kids poisoned by lead on their bedroom wall. That's not right.
Next question is from Laura Hancock at Cleveland.com.
Governor, Auditor Keith Faber said that officials withheld the extent of the problems with the unemployment fraud and stalled on beginning anti-fraud measures. ODJFS is part of your administration. How can you stand by the deception from people who are part of your administration?
Well, I'm going to let Matt Damschroeder answer that. I think Matt is on. I've asked him to come in, take over. We also ask many people from the private sector who have come in to take over. Matt's done a good job. Matt?
Thanks, Governor. I think as the governor said, we've done a lot of important work over the last several months in improving things, both in terms of fraud detection and protections, reducing the backlog and the call center and the like. We're working closely with Auditor Faber's office now on two audits that his office is conducting. One is a performance audit required by the legislature from House Bill 614 of last year, and also a new audit that's under his general authority. So, there's certain things that we can't really go into depth on as a result of those ongoing audits. But I think, we're working closely with him now, and we'll have more report as we have information coming out from those audits.
Governor, next question is the last question for today, and it belongs to Scott Hallis of the Xenia Daily Gazette.
Hey, Scott.
Hey, Governor, how are you?
Good, sir.
Good. I'm batting last today, so I guess I got to come up with a good one, but I'm not sure how good this is. With regards to the lottery, one thing I've seen in a couple stories that have been written by other publications is it seems to be unclear what income tax implications there may be for the 5 winners. Are we safe in assuming they're going to be subject to taxing on that and all the normal income things with lottery?
Yes, I assume that they pay income tax depending on what bracket they're in. just like someone who, wins the lottery. So I'm not the tax expert, but, applicable laws will certainly apply. Let me just close. Yesterday, May 12th, would have been the 201st birthday of Florence Nightingale, founder of modern nursing, marked the final day of the National Nurses Week and School Nurses Day. Nurses are so vital to the health and well-being of Ohioans during the past year. They certainly have emerged. They were heroes before, but I think we started to appreciate them more maybe this year than we have in the past, because we know what they're doing every single day. Whether in schools, whether in hospitals, clinics, nursing homes, elsewhere, nurses have faced just unbelievable challenges, and they have met the challenges. Ohio's nurses are a major part of our COVID-19 vaccination team. I see them in work every time I go to see a vaccination site. Having great success, getting shots in the arms of so many people is really dependent upon, to a great extent, the work that they're doing. I want to thank all of our nurses. Thank you. On behalf of the people of the state of Ohio, thank you for what you do each and every day. Through Saturday, we are also celebrating National Hospital Week. Our hospitals, always a place that we look to for help and assistance and to save lives, but they have become a battleground area in the fight against COVID. Again, it's the hospitals who are really working so very, very hard to protect our loved ones and to keep us safe. They've shown great strength and courage for their patients and their communities, and they have been our great, reliable partners. We look forward to continuing to work with them. So to all of those nurses and all of those who are working in hospitals, whatever your job is, we thank you very much. Thanks, everybody. Wish you all a happy day. Fran and I are off to Miami University's graduation. We have two grandsons whose graduation is being celebrated this year because it was virtual last year. Hope everybody has a good day.